Hi.
Now let us see why these cricketers are prone for impingement of the hip. Now imagine a wicket keeper. A wicket keeper, he has to bend his hip and force it inwards so that it doesn't miss the ball. So in that position, what we call as the hip impingement in position, where the hip is adducted, rotated inside and then flexed, causes damage to the bone, resulting in overgrowth of the bone and eventually impingement. Another example is fast bowlers. Now imagine fast bowler bowling at speeds of 90 miles per hour. With that speed, when he has a forefoot contact, there are forces, what we call as the ground reaction forces, which can be up to 10% of the body weight going up along the leg into the hip, and then can cause damage to the bones, to the ligaments, to the cartilage. All these can cause what we call as impingement of the hip or femoroacetabular impingement. Coming to treatment part, apart from physiotherapy exercises, once the damage is confirmed by a X-ray, usually sometimes we ask for an MRI, or better an MR arthrogram, where we inject the dye and then in the joint, and then we see the MRI that will pick up smaller injuries as well. Now once we have a diagnosis, what the treatment part is what is called as an arthroscopic treatment. In an arthroscopic treatment, which is essentially a keyhole surgery, we make 3 small holes. We pass a tube inside, which is essentially a camera. So we look inside the joint, we take care of the cartilage, we look at the joint properly, we look at the bones and then the labrum. We clean up the extra bone which is there in the ball and the socket, and then we reattach the labrum which is injured, and then we clean the cartilage which is damaged. Now these 3 things we do simultaneously in a single setting, and then we put the patient in the rehab immediately. So the patient or the player usually has to undergo a rehab protocol where first 2 weeks he'll be on crutches, then slowly we increase the weight bearing and exercises, and then strengthening and then balancing exercise. In 3 to 4 months he'll be again fit to resume his practice and then matches. Thank you.